Hello to everyone, it's me Dr. Faisal from Mid Medicos. Today we have a first lecture about the 100 most important gross anatomy conception. So we will cover it in numbers of short episodes. So first we will understand and then we will memorize and then we will apply. So our first topic is about lumbar puncture. Lumbar puncture is when a lumbar puncture is performed, the needle enters the cerebrospinal, the subarachnoid space to extract cerebrospinal fluid. So one is spinal tap and the other one is spinal block. Spinal tap is those lumbar puncture in which we are extracted the cerebrospinal fluid from the cerebrospinal from the subarachnoid space in a diagnosis purposes, for our testing purposes. And the other one is spinal block is those lumbar puncture in which we are injecting the anesthetic injection for the anesthetic purposes. So what is the exact location of the lumbar puncture where we can inject these? So the needle is usually inserted between the L3 and L4 and L4 L5. So this L3 L4 or L4 L5, this two region is the region of the lumbar puncture. So level of horizontal line through upper point of LE crest. So this is the region where we can do lumbar puncture here. This is the LE crest, and we say that LE crest like an horizontal line to upper point of the LE crest. Here we can do it is the L3 L4 and L4 L5. So here we can do the lumbar puncture. And remember, the spinal cord may end as low as L2 in adult and does end at L3 in young children, and dural sac extend caudally at level of S2. And we say that why we cannot do lumbar puncture in L2 region, in L1 region, in why in thoracic region? Because the spinal cord is come up to L2 region in adults and downward to L3 L4 it's not come. Therefore we can do lumbar puncture here in this region, in L3 and L4 region, because if we are injecting, if we are giving the lumbar puncture, it will be not harm the spinal cord, because spinal cord is come to L2 region, not L3 L4. And in children this region is L3 region in children. So, and we know that the dural sac where the cerebrospinal fluid is come is up to S2 region. The S2 region, up to S2 region, the cerebrospinal fluid is come here. And before the procedure, the patient should be examined for sign of increased intracranial pressure, because the cerebellar tonsil may be herniated through the foramen magnum. So like before lumbar puncture, we should check, we should examine the increased extracranial pressure. If there is an increase in intracranial pressure, then we have to not do lumbar puncture, because if we do lumbar puncture, it will be more increase the intracranial pressure, and as a result maybe herniation to foramen magnum occur. So here we have a picture. So this is the lateral position of the patient. We will do lateral position on the patient and we will do lumbar puncture here. So if we are doing lumbar puncture, first it will cross the layers. First it will cross the skin region, and then it will cross the fascia, and then it will cross the ligamentum flavum, and finally it will reach to the cerebrospinal fluid. The cerebrospinal fluid is present in subarachnoid space. So in this subarachnoid space it will reach. So this is the region we can see here clearly. We can see here it is the L3 region, and it is the L4 region, and it is the L5 region. So L3 and L5 we can give, like here this is given, and the other one is here, which is L4 and L5 region. So this is the L4 and L5 region through which we can do lumbar puncture. So this is the two region. This is the L3 L4 and L4 L5 region. The other one is the second topic is about the herniated disc. So there are basically we have four herniated disc. We have four herniated disc. Basically the two herniated disc is in cervical region, and the two herniated disc is in the lumbar region. So the two herniated disc which is in the cervical region is SC5 and C6 and C6 and C7, which is in the lumbar region L4 L5 and L5 S1 region. So it is the place where the herniation may occur. So it is, first of all, we have to know about the herniation herniated disc, like it is like usually occur in this region, we as I told, but in it is mostly occur in like more than younger than like age of 50 year. Like if there is more age of 50 year, so mostly occur to that individuals. And herniation may follow degenerative changes in annulus fibrosis and caused by sudden compression of the nucleus pulposus. And basically it is changes in the nucleus fibrosus. And this nucleus fibrosis is what? Nucleus fibrosus is the tough covering layer of the nucleus pulposus. The nucleus pulposus, it is the nucleus pulposus. The nucleus pulposus is tough covered by the annulus fibrosus. This is the annulus fibrosus. The annulus fibrosus is a tough layer. If there is damage to the annulus fibrosus, the nucleus pulposus will be protruded posteriorly, due to which herniation may occur. So we can say in easily words that what is herniated disc? Herniated disc is the protrusion of nucleus pulposus posteriorly when there is nucleus fibrosus, annulus fibrosus is damaged. So when there is annulus fibrosis is damaged, nucleus pulposus may be protruded posteriorly. So here we can see the nucleus pulposus is protruded posteriorly. Why? Due to damage of annulus fibrosus, because annulus fibrosis is the tough covering layer which covered the nucleus pulposus in between two vertebrae. And the other one is here we also tell about this. But herniated lumbar disc usually involve the narrow root one lumbar below transverse root. The herniation L4 L5 will compress L5 root. Of course, if L4 L5, there will be, of course, they will be compress the L5. If there is L4 L5, it will compress the L5 because it will downward. The force will be on down position. And here we have the abnormal curvature of the spine. So what is the abnormal curvature of the spine? Abnormal curvature of the spine, there we have three types of abnormal curvature of the spine. One is kyphosis, and the other one is lordosis, and the other one is scoliosis. So this is the three curvature of the spine. So first of all, we have to know about the kyphosis. What is kyphosis? Kyphosis is an exaggeration of the thoracic curvature that may occur in elderly person as a result of osteoporosis. Like when there is osteoporosis, kyphosis may occur, because kyphosis is basically the curvature of the in the thoracic region, the thoracic region when there is curvature. But in case of osteoporosis, it may occur the kyphosis. Compression of fracture vertebral body, a disc here will be disc degeneration may occur. So like if there is disc degeneration, if there is like osteoporosis may occur kyphosis. And lordosis. What about lordosis? Lordosis is as an exaggeration of the lumbar curvature that may temporarily and occur at a result of pregnancy, spondylolisthesis, or port belly. So basically is the here we have pregnancy. If there is pregnancy, it may occur lordosis, in which there is curvature in the lumbar region which is forward, little bit forward anteriorly. It is lordosis. And scoliosis, so from the name we can also, when if there is like S-like shape, like we can say S-like shape but like a little bit opposite, like we can say it is scoliosis. For memorization I says for S shape, so it is scoliosis. Scoliosis is basically the complex lateral deviation or the torsion that is caused by the poliomyelitis. So mostly it is caused by poliomyelitis or leg length discrepancy or hip disease. So if there is hip disease, if there is discrepancy, if there is leg length, if there is poliomyelitis, so it may be causes scoliosis, which is the zigzag position of the spine. And here we have questions, like question that describe kyphosis but doesn't use the term, and the question is asking like you about the curvature. Yes, the question is asking about the curvature, about the curvature of the spine is when the posterior is looking straight forward. So no, like we have to know if the curvature is looking forward, we will know that there is like kyphosis. They are talking about kyphosis because this curvature in this region, thoracic region, if we see the curvature, this is like look forward in this region. and they are talking about the kyphosis. And the second one is cervical spine is extended first, and then posterior can look forward, and then this of course posterior can look forward, so they are talking about the kyphosis. And the other one is upper limb fracture, humerus fracture. So upper limb fracture, if there is fracture in this surgical region, what may occur? If there is, let's suppose, if there is in this surgical region, if there is fracture, if there is fracture in this shaft region, what may occur? If there is fracture in this median epicondyle region, so what may occur? If there is fracture in supracondyle region, what may occur? So this is the question, which may arise in our mind, but we have to cover it in our position, in our mind, that which fracture may result in nerve injury, in artery injury. Like here we can easily conclusion of the site of injury and site of the nerve, from where nerve passes. So in site of potential injury to major nerve in fracture of the humerus, like first axillary nerve. First axillary nerve is what is like axillary nerve and posterior humeral circumflex artery at the surgical neck. So it comes at the surgical neck, if there is fracture in the surgical neck, axillary nerve and posterior humeral circumflex artery may be disrupted. Maybe there will be complication there if there is surgical neck, because in this surgical neck, this we can see here, this is the axillary nerve. This is what? This is the axillary nerve. So if there is fracture in the surgical neck, axillary nerve may be damaged. And if we are talking here about the radial nerve and the profunda brachii artery at the mid shaft, it is about what? It is about the mid shaft. The mid shaft is here. The mid shaft, if the mid shaft is fractured, maybe the radial nerve will be damaged, because the radial nerve passes through the mid shaft. If it passes through the mid shaft, it is fractured, it may be occur here at the brachial artery and the median artery at the supracondylar region. So the brachial artery and the median nerve, it is the supracondylar region. What is the supracondylar? It is the supracondylar. If there is the fracture on the supracondylar region, so there will be maybe damage to the median nerve, because median nerve is passed through here. So this is here the median nerve. Like we can write it has here median nerve. So it is a median nerve, it is a median nerve. We can say it is a median nerve which is passes through supracondylar region. And the other one, if there is injury to the ulnar nerve, if there is a fracture to the median epicondyle, if there is fracture to the median epicondyle, so there will maybe injury to the ulnar nerve. So we will say for ulnar nerve, we will go for ulnar nerve. So we have a question here. Question tell you that there is a surgical neck fracture. If there is surgical neck fracture, of course we will go for, if there is surgical neck, of course we will go for axillary nerve. But if there is a surgical neck fracture and they also tell you that the axillary nerve is damaged, so they also tell you, so that the question is asking you what to structure when arteries, I can't remember, will anastomose here, so that the limb will start goes supply. So what to structure? If the axillary, if there is surgical neck fracture, if they tell us about the axillary nerve also, so we will go for the posterior humeral circumflex. The posterior humeral circumflex will be posterior humeral circumflex artery. It may be disrupted, these two things here. And the other one is question like where you need to know about the fracture at the supracondylar of humerus, would you damage median nerve, would damage median nerve. So if there is supracondylar, they are talking about this region. If there is this fracture, the supracondylar region, so maybe the median nerve may be damaged. So the other one is we have fracture of distal radius. So we have to know about the types here. The fracture, there are two types we have. The one is the flexion fracture of the radius. Here we have what? We have the fraction. We have the flexion fracture of the radius, which is called Smith fracture. This is the word. This is basically Smith fracture is the fracture which is inward fracture. And this is the Colles fracture. This is the extension fracture of the radius. This is the Colles fracture. This is outward and this is the inward. This is inward and this is the out, as the name indicates. So here we will study like transfer fracture within the distal 2 centimeter of the radius. Most common fracture of the forearm after 50, like after 50 year of age, after 50 year of age. So it may occur the transfer fracture within distal 2 centimeter of the radius. And the Smith fracture, I told you that is inward fracture. They're talking about the flexion fracture of the radius, result from fall or below on the dorsal aspect of the flexed wrist and produce a ventral angulation of the wrist. The distal fragment of the radius is anteriorly displaced. It is anteriorly displaced, like anteriorly displaced. Therefore, we say that it is like inward. And Colles fracture is, which we told that Colles fracture is outward fracture, extension fracture of the, as the name indicates, it is outward fracture. Result from the force extension of the hand, usually is a result of trying to aid the fall of the outstretching the upper limb. Distal fragment is displaced dorsally. Dinner fork deformities, like you can say dinner fork deformities, like we can say from here, like dinner fork. For eating, we know dinner fork like this shape, so therefore we give name these two displaced dorsally as dinner fork deformity. And after the ulnar stellate process is evolved, broken off. And the other one we know about this scaphoid fracture. Scaphoid fracture is what? In this scaphoid fracture, we know that scaphoid fracture is like it is the carpal bones which is present in our hand, and this is it's shown here, the scaphoid bone, but it's mostly broken down in which position, like here we study, we write here like occur as a result of the fall into the palm. When there is like fall down on the palm, when the hand is abducted, and when it's fall down, so there will may occur like scaphoid fracture. And pain occur primarily on the lateral side of the wrist, especially during wrist extension and abduction, and pain mostly occur on the lateral side of the wrist. But pain mostly occur on the lateral side as the result of the fracture of the scaphoid bone. And scaphoid fracture may not show on X-rays film. This point is to be noted that scaphoid fracture may not show on X-rays film for 2 to 3 weeks, but a deep tenderness will be present in the anatomical snuff box. Like if our patient is come to our casualty, how we will examine, how we will know that there is fracture in scaphoid? Because if we go for diagnosis and X-rays to diagnose the exact position, an X-rays we cannot examine for 2 to 3 weeks, but we will examine for its positions. And we will also examine for the proximal fragment may undergo vascular necrosis, but blood supply is interrupted. So we will go for this thing. Basically here we study that especially during the wrist extension and abduction. So if there is pain in the wrist extension and abduction, we will say that there is maybe fracture of scaphoid fracture, because scaphoid fracture is a result of the pain in the lateral position when we are abducted or extension of our hand. And the proximal fragment may undergo vascular necrosis because of the blood supply to intervene. I told this. So this is the position, this is the extension position in which we have mostly in this position when this is fractured, and this is the all bones which is written here. But when the scaphoid bone is fractured, so in this position, like in this case, it will for 2 to 3 weeks it will be not shown in X-rays, but we can examine it by like moving the hand extension abducted. If it is pain, of course we will say that it is like scaphoid fracture. And what is the boxer fracture? So boxer fracture is those boxer fracture is like it's basically the neck of the metacarpal bone are frequently fractured during the fist fight. If there is like fist fight, like when we are finger is coming collection, and like our hand is we become a strong our hand, and mostly in MMA, in UFC fighter, they having doing a fist fight So in this case, the neck of the metacarpal bone may be fractured, but in those, because they are fist fighting in UFC, and typically fracture second and third metacarpal bone. But it is mostly in professional boxer. If there is more professional boxer like Habib, McGregor, like this, like in UFC, and in other fist fight games, if they are fighting like they in professional boxer, their second and third metacarpal are seen to be broken, to be fractured. And if their fracture is fifth and sometimes fourth metacarpal are seen in unskilled fighter. When there is unskilled fighter, street fighter, you can say, like those fighters which are we have no skill, so their fifth and fourth metacarpal may be fractured. So it is the like position of the proximal fracture fragment, the which is shown here. So it is the fracture here which is shown. It is the exact fracture of here, which is the fifth fifth metacarpal bone is fractured, but it is of those unskilled fighters, because they're mostly fifth and fourth is fractured. And the other one is rotator cuff. This is our the last topic, the last topic of that episode. It is the rotator cuff muscle. For rotator cuff muscle, we have here mnemonics for as seats. So seats for rotator cuff, how we will memorize that? How many rotator cuff muscles are there? We will say there are 4 rotator cuff muscles. So we will say there are how many? There are 4 rotator cuff muscles. So for rotator cuff muscles, first we will go for like this. S is represented supraspinatus, this is represent supraspinatus, this is represent infraspinatus, and this is represent teres minor, and this represents subscapularis muscle. So from here we know that there are 4 muscle, rotator cuff muscle, and which supraspinatus, infraspinatus, teres minor, subscapularis muscle. So we are here like first of all, like there is support reinforced joint, and support like the shoulder joint by the forming the musculotendinous rotator cuff around it, like musculotendinous rotator cuff around it. Like this is like this is the shoulder joint, and this shoulder joint, this is the humerus shoulder joint. So the humerus head, and this is surgical neck, and this is like the hand. This is the we put, and like this is the representation of the rotator cuff muscle. Like this sits it represent the this rotator cuff muscle. From that as subscapularis, supraspinatus, infraspinatus, rotator cuff. But like we have to know about this that muscle, the exact position of that muscles. And we know like this subscapularis muscle is below the lesser tubercle, and this teres minor is on this position, which is the greater tubercle is on the above, and the greater tubercle there is a supraspinatus, and in this supraspinatus there is infraspinatus muscle. So reinforced joint on all sides there is reinforced joint of this rotator cuff, except inferiorly where dislocation is most likely. So rotator cuff is muscle of supraspinatus, infraspinatus, teres minor, and subscapularis seats, as I told earlier. So this is all about the rotator cuff muscles. So here we have a question related to this. A woman had a left mastectomy. So there is mastectomy of the woman week after surgery. After surgery, like they have a mastectomy, she could not touch her left hand to her right shoulder. Then in this case, she could not touch his left hand to her right shoulder. Why can't she do this? Damage to what? Why she don't? Why she cannot touch her left hand to right hand? So what we will go? So they like we will go forward. I think I choose the image to pectoralis major muscle. Like we will go for the hair pectoralis major, because pectoralis muscle is doing this. And but the question, like which type of question we have, we have to go on each and every side, and we have to think about all the surrounding muscles as well. So that was the last topic of that episode. So the remaining will be on another episodes. And thank you so much for watching. So subscribe my channel for more.